There are 3 methods for HIV testing. These are culture methods, which are used in research institutes. The second method is the polymerase chain reaction method. It examines They are divided into 2 types, qualitative and quantitative studies. Qualitative studies include HIV DNA polymerase chain reaction and HIV RNA polymerase chain reaction. Quantitative studies involve determining the viral load. That is, measuring the number of viruses in 1 milliliter of blood. The most common methods are the third type, right? This includes the enzyme-linked immunosorbent assay itself, the immunoblotting method, and the immunochromatographic test. When a person first comes to the clinic, we test them with an immunochromatographic test, that is, a rapid test. The person sits down in front of the tester. The tester conducts pre-test counseling, and then the package with the test strip is opened. Then the patient's blood is taken. The blood is taken from a finger. It's done with a painless lancet. The blood is placed into the test well, then a buffer is added, and after 15 minutes we can expect the test result. When we get the test result and it's negative, and our client has had risky behavior, we always recommend that they come back to us again in 3 to 6 months, depending on when the risky behavior occurred. Why do we do this? Because with HIV infection, there is a window period that lasts from 6 weeks to 3 months. And if our client comes in and their risky behavior happened, for example, just a few days ago, then of course we emphasize that they need to come back for an HIV test again in 3 months in order to get a reliable result. The further management of our clients depends on the test result. If the test is negative, as I already mentioned, our client can come back to get tested again at our clinic. If the result is positive, then this client, now a patient of our clinic, is tested with 2 more tests from different manufacturers. All of this is done within the next 15 minutes, and we proceed to the so-called verification stage. Then we carry out the identification stage and register the person on the same day, within a couple of hours. And on that same day, our patient can already receive antiretroviral therapy here at the clinic, provided they don't have any opportunistic infections or tuberculosis. Our clients always ask about the reliability of HIV testing. The accuracy of the results of rapid tests, specifically immunochromatographic tests, ranges from 92.6% to 100%. And these rapid tests are also used differently for different clients. That is, for the initial screening, we use a test system with lower accuracy and always inform our clients that they should come back for another test if they have engaged in risky behavior. In this way, we avoid false negative results. If we see a positive result and our client doubts whether it is truly positive and reliable, in that case we use other test systems that are more specific and have 100% accuracy. And as I mentioned earlier, in order to officially register a case, we use at least 3 test systems with different specificity and sensitivity, all with 100% accuracy. The most frequently asked questions are about when we can actually detect HIV in the blood. Right? We detect the presence of antibodies in the blood, which are produced between 6 weeks and 3 months after infection. So, if a person comes in and had risky behavior, for example, 3 months ago, then the test we do for them now will be reliable and will already detect the presence of antibodies. How long does it take before we can get a reliable result? Right, according to all the guidelines. That is, we can only get a truly reliable negative result if the person hasn't had any risky behavior in the last 3 months. At this point, we conduct the testing. If we get a negative result, then it is indeed reliable. During the pre-test counseling, which every client who comes to our clinic receives, we always explain that when HIV enters the body, that is, into a person's bloodstream, our lymphocytes produce specific antibodies, which we can detect with our rapid tests and our enzyme immunoassay studies. If someone is worried that we might give them a false diagnosis, I believe there's no need to worry about that, because we use at least 5 test systems to establish an HIV diagnosis. And then, on the same day, we collect a sample from our patients to test for CD4 cells. These are the cells that are, so to speak, involved in the process. And we also collect a sample to test for viral load. In other words, every patient who registers at our clinic undergoes this test. This is what I mentioned earlier, polymerase chain reaction, a quantitative test to determine the number of HIV RNA copies in 1 milliliter of blood. We also collect a CD4 cell sample on the same day. These are lymphocytes that have CD4 receptors, and by their count we can determine how long the disease has been present. In other words, what stage the disease is at. We get the results of this test literally within a day. By the next morning, the test is already ready, and we can inform our client and use it to determine the stage of the disease.